I would like to welcome Dr. Jeff Rouse to the Doc Podcast.
If I see them deviating from normal craniofacial growth and development, whatever the age is, I want to intervene at that point in time because it's setting up a barrier to normal breathing. Because all, in fact, is said it can cost these kids up to 10 IQ points. I just talk to the parents and tell them what we're doing now is about the health of your child. It has nothing to do with their teeth. A huge part of not being able to breathe well is anatomy. We're not dealing with treating apnea. We're treating the signs and symptoms associated with it and then looking at what could be the culprit. The culprit is the anatomy. I get a ton of pushback from orthodontists, and I am the biggest advocate of orthodontics. I think orthodontists are the key to the health of our patient. I just think they're on the wrong side of history thinking that they shouldn't intervene early. Are you really willing to just let them grow with that and then say, well, the out is that we can always do orthodontic surgery? Only pay attention to tooth-to-tooth contacts and disocclusion of teeth. We don't pay attention to where they are in the world. We don't think in terms of making the housing of bone larger. The answer has to be slenderize the teeth or take some teeth out. Taking out 4 bicuspids is not going to create apnea. The fact that you have to take out 4 bicuspids is what's going to cause the apnea. Taking out the teeth, it never makes the airway better. It either keeps it the same or it worsens it over time. Yet to see a study that said we can intervene to accomplish what I just said, as far as structurally changing a person from constriction to normalcy, and they get worse. I've never seen that.
Me neither.
The answer, honestly, is that they don't feel comfortable treating a 3, 4, 5-year-old. Instead of going, I just don't like seeing them, you typically come up with a reason why you shouldn't see this, right?
You don't want to break free to go deal with a 4-year-old, especially if you've never been trained how to incorporate that.
Just say, I'm not comfortable seeing them. They mess up my schedule. A ton of general dentists have learned to do early intervention orthodontics on those kids because it's just, they're comfortable in their practice managing them. We need orthodontists that are willing to be more contemporary in their thought process, or someone to say, well, you're working outside of your scope and you're practicing medicine and stuff. I wish that person would actually start practicing some dentistry that led to better medical solutions down the road, because their patients would really prosper from that.